are saying today. So thank you, Kendra, as always. Going straight into it. This is hot off the press from the Department of Health. As of yesterday, there were 407 new cases of COVID-19 in Erie County as of yesterday. 2,359 total cases over the past 7 days, which is a big jump on a weekly basis. We'll talk about that. 247 new cases per 100,000 residents over the past 7 days. I think this is the highest amount we've had in months. And in total, we are at 110,223 total confirmed COVID-19 cases. Those are individualized cases per person. They are not duplicates, and there are duplicates out there where some people have had COVID-19 more than once. Confirmed cases over the past 6 weeks, you see there's a pretty big jump. This is the week ending of October 30th. So as you see, for the week ending of October 30th, there was 2,212. I'm just going to go back one slide because for the past 7 days, there were 2,359, so we continue to grow. But if you go and look at where we were from the end of September, in which we had 1,671 cases the week of September 25th, which was 175 cases per 100,000 persons over a 7-day period. We're now at 2,212 through the 30th. That has increased since then, but there's a 27% increase in weekly cases following a 2-week decline. 50% of the cases in the 12 to 17-year-old category are not fully vaccinated. Excuse me, let me rephrase that. I read it wrong. 50% of 12 to 17-year-olds are not fully vaccinated, but they are making up 86% of the total cases in that age category. So 50% of the total age category in the 12 to 17 age range are making up 86% of all cases in that age range. So it's just another example of get your child vaccinated and you will definitely, in all likelihood, avoid or have a greater chance of avoiding COVID than not. Confirmed cases in an age group, total new cases per 100,000 persons in the past 7 days. This is by age group, and you see all of these are going up. The highest age group with cases per, for broken down over 100,000 persons over 7 days is the 30 to 39-year-old category. And the next highest is the 40 to 49. We are still seeing cases in every age category. And unfortunately, those numbers are increasing. So what we just want to remind everybody is that it doesn't really matter what your age is. You could catch COVID, especially if you're not being safe and wearing a mask out in public if you're in a location where many people otherwise are not. I do have to admit, I've gone around town, and when I go to shopping stores and other locations, I see people wearing masks. I think what we're seeing are individuals kind of letting their guard down when they're around people that they know, that maybe not family, but others, and they feel like, oh, that person probably doesn't have COVID. I know them, a coworker or a friend, and unfortunately, COVID is being transferred to a lot of people in our community. Hospitalizations, we're seeing a growth in hospitalization. This is the chart for the last 2 weeks. You can see the steady incline over the last 4 days. The low that we had was at the end of October. We had 111 individuals that were COVID-19 patients on October 22nd, and we are now up to 145 patients as of the most recent day, which is November 1st. So we are seeing a steady increase in overall patients. We've also seen a little increase in ICUs and airway assist, which is not surprising. More patients you get, the greater chance you have of ICU increases. 29 persons have died in the hospital during the past 2 weeks from COVID-19. These are just Erie County deaths of hospitals. They may not all have been an Erie County resident. We'll talk a little bit about mortality as it pertains to Erie County residents soon. But 29 persons have died in the hospital during the past 2 weeks. I have heard with regards to COVID-19 cases increasing in the other Western New York counties. They are increasing, and I am aware that some individuals, I believe in the last 2 weeks, well, I'm aware in the last 2 weeks, individuals who died in Erie County hospitals are actually a resident of Western New York County other than Erie County. So there's no real safe place. COVID-19 is out there, as we know. The Delta variant is very virulent, and unfortunately people are dying an average of basically 2 a day over the last 2 weeks. Now, mortality data, you'll see the breakdown based off of 2020 to 2021. We're really showing this because we have had many more deaths in the months of September and October for COVID-19 in 2021 than we had in 2020. In fact, in the month of October, we've had 68 deaths this month through October 28th as compared to last October when we had 31 deaths. So when we close out October, which will have that data by the beginning of next week, we will probably have had over 70 deaths in October. And it is various age ranges, including 2 individuals under the age of 40. Since July of this year, the average age of death, unfortunately for individuals who died who were fully vaccinated, it was 82. For those that were not fully vaccinated, it was 70. But I think this is a really interesting statistic that we pulled out. 76% of all deaths in people not fully vaccinated were younger than 80. 64% of all deaths in fully vaccinated persons were aged 80 and older. So it also says to our friends and family in the community who are of older age, especially those that are 70 and older, if they got a shot to begin with, or the shots, they completed the regimen and they haven't gotten their booster, they should get their booster ASAP. Because you see it with regards to the fully vaccinated, 64% of the individuals who died since July were 80 and older. And if you are under any age and you haven't gotten your COVID-19 shots yet, you really should. We have seen an increase in deaths in the last few weeks, and the sad part with the increase in hospitalizations just in the last 4 or 5 days, that generally means we're going to see an increase in deaths in probably 10 days. Just because when your hospitalizations go up, ICU numbers go up, usually within 10 days to 2 weeks thereafter, the deaths have gone up too. So I'm very concerned that we will see an increase in deaths about a week and a half from now. Mortality data as it pertains to race and ethnicity. We haven't shown this slide in a while, though we have been sharing it on our weekly updates that are released to the press. There really hasn't been a change. We wanted to ensure if there was a change with regards to the percentages based on race and ethnicity. There really has not been a change. On July 1st, 79.6% of fatalities were among whites. That is now 79.4%, so it's just statistically a minor change, and the same thing with black or African Americans. It actually has gone up slightly, 0.2% to 16.1%, but we haven't seen a tremendous difference, so it's basically still sort of affecting the community as it was pre-July, pre-Delta. Individuals are dying all across our community, in the suburbs, in the city, in the rural areas, and we just want people to be safe out there and understand that even if you're vaccinated, you can catch COVID-19. It usually will protect you from a serious illness. If you're over the age of 70 and were previously vaccinated and you have not received your booster yet, you should get your booster ASAP because you are at much higher risk for hospitalization and death than somebody who's younger. If you have not been vaccinated at all, I don't know what you're waiting for at this point, but the data shows you are high risk, and as we just noted in the prior slide, 2 people under the age of 40 died in Erie County this month. Actually, thankfully, had nobody in the 40 to 49 age category, but we had 10 people aged 50 to 59, so my age category, that died. And my understanding is the vast majority of those people were unvaccinated. So I'm going to turn it over to Dr. Burstein right now to talk about Erie County Responds and all we're doing, including very important information with regards to vaccine clinics that we will be starting very soon with regards to those under the age of 12, now that the vaccine, the Pfizer vaccine, has been approved for the 5 to 11 age category. So Dr. Burstein?
Sure. Thanks. It's a spoiler. So yes, vaccines are for the 5 to 11-year-olds is one of the many interventions that we're trying to undertake. So first, let me continue presenting some data. So these data are looking at our weekly student and school staff cases of COVID-19 in Erie County, starting from the very end of August and up until this past week, ending October 30th. So just want to alert you that, especially last week and even some of the week before's data are not complete. You know, sometimes it can take a week or more for the test results to come to us, And so, so we expect those numbers to, especially for this past week, to continue to increase. So our numbers in the schools are not going down. They remain high, unfortunately. So I know there's been a great deal of buzz about the test to stay option as an option to help kids who have been close contacts, are asymptomatic and not fully vaccinated, who otherwise would have to go into quarantine to remain in the classroom, so in school. So I'm sure as you all know, last week the New York State Health Department sent an informational document. It was not an advisory, it was just information about what they see as what should be in place for test to stay. They made it very clear that they do not recommend test to stay for local health departments. They said, however, if local health departments choose to undertake this, they laid out some parameters that we need to follow. So right now we are busy collecting information to make sure that if we do decide to impart on a test to stay, that we will have the best plan possible. So we are making sure that we understand all the parameters in the New York State Health Department informational document. We are talking to other local health departments. I've been in conversations with Monroe and Onondaga County. Yesterday I was on a call with probably 10 other local health departments in New York State that are looking at possibly sharing a common protocol for test to stay and sharing information. I know of just one local health department, a very small local health department, is just starting to pilot the test to stay protocol. So it's at the very beginning. We're still collecting information. I mean, one barrier is the availability of the right type of test, these rapid antigen tests that are CLIA waived. We know that there is a national shortage. I know the Binax now that we've been relying on in New York State are in short supply. We heard that next month the supply chain will open up. However, right now they're very, very difficult to obtain. We're also looking at the scalability of doing this in Erie County schools. It's labor intensive for the schools and Erie County Health Department. So we just have to understand if both parties are able to take this on. And then also ultimately looking at the risks and benefits of public health and the safety and welfare of the students and staff if we do undertake this. But the bottom line is that this all goes away, this all becomes irrelevant if students and staff are fully vaccinated. Then nobody has to be in quarantine, and we don't have to think about doing any type of test to stay option. Again, this all goes away, and hopefully, this week, 5 to 11-year-olds will be able to start getting vaccinated. So, it all starts with testing, knowing your status of COVID-19 to be able to make sure that our community is safe and reduce transmission. So the Erie County Health Department Public Health Lab is still offering free COVID-19 PCR tests for the community. They are available and results are available in 1 to 3 business days. And then for students and staff at K through 12, we're offering the ID Now, the rapid, the point of care nucleic acid amplification test to make sure they can get back to school as soon as possible if they have symptoms. So I want to encourage everybody, even if you have any type of symptoms of COVID-19, even you think it's just the sniffles or you get the same thing every time this year, it's no big deal. You don't know unless you get a test. It's really important to know your status. That is one of our strategies to reduce transmissions and bring our numbers down, in addition to masking, which is also super important to keep our numbers down. You can call 716-858-2929 to schedule an appointment. I just want to talk about our vaccination numbers. They're slowly creeping up, very, very slowly. So these are data looking at the proportion of Erie County residents have first doses and then who are fully vaccinated. So looking at all Erie County residents, about 2/3, 65% of all Erie County residents, including kids that are too young to get vaccinated, have had 1 dose. And then about 74% of our adults that are able to consent themselves and decide if they want to get get vaccinated have had at least one dose. And then looking at the fully vaccinated, which is the bottom line to keep us all healthy, about 60% of all Erie County residents, including the young kids, have been fully vaccinated, and almost 70% of adults 18 and up who can consent themselves are fully vaccinated. So again, we're hoping we can get those numbers up, and we're hoping that people who are fully vaccinated are due for a booster shot get that booster vaccine. So we are trying to be aggressive about making sure that everybody has access to the vaccine. So we have all our clinics that are available for COVID-19 vaccine available on our website at erie.gov/vax. We recommend that you register, especially right now our clinics are a little bit busy with booster doses, which is great, but you'll wait a lot less longer if you can register. However, we welcome walk-ins on every single clinic except for this Saturday, which I'm going to talk about. We're going to vote to the 5 to 11-year-olds. However, every single clinic, people can walk in if they want, and we have doses for every age group and every vaccine. So if you need a Pfizer, Moderna, we don't really have very much J&J. If you need a first, second, or booster dose, we welcome all those individuals. And then if you just want to stay in the comfort of your own home and get a vaccine, you can get our Vax Visit program at no charge. Just call 716-858-2929. We will take your information, give that information to the Home Health Nurse Agency, Buffalo Home Care, that does the home visits for us to vaccinate, and they will contact you and schedule a time to come and vaccinate you. So please pick up the phone if you see a Buffalo Home Care number calling you. So now the exciting part are COVID-19 vaccinations for our 5 to 11-year-olds. So as you know, that yesterday the CDC made its final recommendation for the FDA-authorized COVID-19 vaccine for children 5 to 11 years old. So I'm a pediatrician, I'm celebrating this. So we are busy organizing clinics to make sure that we have access to everybody in the community who decide not to go to their pediatrician to get that vaccine. We just want to make it easy for people. So we just actually received our vaccine late this morning. We received about 2,000 doses of COVID-19 vaccine for the 5 to 11-year-olds. So remember, that's a different formulation. It's a dose of 10 micrograms instead of 30 micrograms. As we see in the adults. So we are going to be partnering this Saturday with Oshai Children's Hospital, our premier children's hospital, to open up a COVID-19 vaccine clinic, and there we're only going to be giving vaccine to 5 to 11-year-olds because we want to make sure we can touch as many of that age group as possible this Saturday, because it'll be really the first big vaccine clinic for that age group in our area. So we ask people to register. Right now, they can register by calling 716-858-2929. We're waiting for the state to complete modifying the state registration system, so hopefully that'll be online tomorrow, and then people will be able to register on that tomorrow. But right now, you can give us a call at 858-2929, area code 716, and we'll take your information and then enter that into our database. So we will be at Oshai on this Saturday from 9 to 5, and hopefully we can vaccinate a good chunk of 5 to 11-year-olds who decide to come there instead of their primary care pediatrician's office. Still, your medical home, parents' medical home is still a great place for your kids to get vaccinated. However, I think Erie County Health Department is a good second choice. So looking at future vaccine clinics, so again, as I mentioned, we're being aggressive to try to get all 5 to 11-year-olds vaccinated. So we are scheduling the next 2 Saturdays after this Saturday, so November 13th and November 20th, big vaccine clinics at our schools. So each of those Saturdays, we're going to have a vaccine clinic in the North Town, a clinic in the South Towns, and a clinic in the city. So 3 clinics each of those Saturdays to make sure that everybody has access to a vaccine for 5 to 11-year-olds who wants one. We'll also be able to vaccinate other people and other age groups. So if parents decide to get vaccinated or siblings decide to get vaccinated that are eligible, we'll be able to accommodate everybody. So again, we encourage everybody to register and we will announce those sites and the registration hopefully in the near future. And so We are also continuing to do fun vaccine clinics. So this Saturday, we are partnering with Bougie Nail Salon to do a shots at the shop vaccine clinics. So you can go to the nail salon shop and get a shot too, in addition to getting your nails done. So I've never had my nails done in my life, but I think it would be a fun thing to do. So I'm going to turn it over for the rest of the presentation and for questions to our county executive.
For the record, I've never had my nails done either. And I don't think I'll be showing up that, but if you want to get your nails done and get a vaccine, show up at Bougie Nail Boutique this Saturday from 12 to 4, Ontario Street in Buffalo, and you can get your nails done and get the vaccine. Finally, before we go into questions, we have the Shop 716 program still going on. We're entering the holiday season. People are looking for gifts. You can buy a $25 Shop 716 gift card and get a free $25 one. We still have the offer. There's still a little bit enough remaining to provide a free $25 gift card if you spend $25, and then you can shop at hundreds of small businesses across Erie County. Go to www.amherst.org/shop716. We want people to take advantage of this. The promotional bonus card will expire as of December 30th. You can buy a card, give the promotional one to somebody else, or keep the promotional one, spend it right away, and give the original card, which has no expiration. But we want people to shop in our local businesses, our small businesses, and the Shop 716 program is a great way to do that. We'll take questions. First, I'd like to take questions on COVID, because I know there's some off-topic questions that'll be taken or offered. Sandra?
In regard to test to stay, just wanted to know if you guys were talking with superintendents about this and keeping them in the loop, whether the $18 million federal grant might be able to help offset some of these costs. Also, we're hearing that there's actually some shortage of the vaccine for 5 to 11-year-olds. I know Erie County's just gotten some, but I didn't know if you've heard whether or not this is an issue.
I know we got 2,100 doses of the 5 to 11. I'll let Doctor talk about test to stay.
First of all, we have been in communication with Mike Cornell, who is head of the Erie Niagara Superintendents Association, and just letting him know that we are collecting information and thinking about what would be the best way to implement this. So we're still in the informational gathering phase. However, we did correspond, I think on Monday, to keeping abreast that we're still gathering information and really thinking hard about what we need to do. And he responded in his email that he appreciates that this is a complicated situation and endeavor, and we want to get it right the first time. So, and then the state has indicated in their informational guidance that we can use some of our CDC state funds for the to pay for the tests, and so we will, and that's what we are planning on doing. However, we are hoping that those tests will be available in the near future. I actually I'm waiting for Wadsworth Public Health Laboratory in New York State to respond to me about options for using some other tests that might be easier to get. So I sent that email last week, and yesterday they told me they're still working on a response. So I'm waiting for that. So we are working hard on figuring out what this could look like, and then the best way to implement this. Because again, we want to get it right the first time.
Can you respond to the access to the vaccine for younger children?
Is there? We received. All I can say is Erie County Health Department, we received our order in a very timely fashion. I mean, the CDC just made their recommendations yesterday, and we received our doses today, so that couldn't be faster. We put in another order for about, I think, 1,200, and so I haven't heard back about that shipment. I have one of my pediatric BFFs told me that she received her doses yesterday too. So at least people who have got in their orders early are receiving their doses. So I think with, it's probably a bit of a bottleneck because there's a large, everybody's ordering at once. And so, however, we know that the federal government has ordered enough, they have enough of the 5 to 11-year-old vaccine to vaccinate every single U.S. Resident who is between the ages of 5 to 11. So it's there. We just, we just have to wait, see how fast that they can ship it.
Any other questions on COVID-19? Brendan?
A couple of superintendents I've spoken with have kind of said we need kind of an end date or, metrics to show when we can kind of get off the restrictions in schools. Do you think that the 5 to 11 vaccine, assuming that a decent number of kids get it, will start to lead to some of those, kind of weaning off of those restrictions in schools?
Well, the question is, when would they be weaned off restrictions in schools? First off, the restrictions are generally issued by New York State. We issued our mask restriction, and New York State followed very soon thereafter with others restrictions as well. And it's all going to be based on vaccination. As we showed earlier, I think 86% of the cases in the youth category are coming from 50% of the unvaccinated. So if parents would get their children vaccinated, we'd be in a much quicker position of actually getting those restrictions out of place. But if certain percentage of the parents are refusing to get their children vaccinated, you're going to have to still have these restrictions in place to protect children, including those who cannot get vaccinated for potentially a health reason. So we're asking all parents to vaccinate their children now if they're over the age of 5. Previously, up until 2 days ago, they couldn't even think about it, but now it's been approved. We're doing our first vaccine clinic for those that are 5'11". On Saturday, we have plenty of other opportunities for those that are 12 and above to get vaccinated. I have to admit, I get very frustrated that some of the loudest parents are the ones saying get rid of the restrictions who are not vaccinating their children. They're putting other children at risk. And they can scream and yell all they want about restrictions, and they have a First Amendment right to do that, but they also need to know that they're part of the problem by not getting their children vaccinated. And if they got their children vaccinated, we'd be much more further down the road to saying we can get rid of the restrictions.
You mentioned that you're still seeing a lot of mask wearing when you go out in public. As the weather continues to get colder going into the holiday season, what is your recommendation for mask wearing and gatherings?
The question is, as the weather gets colder and people are moving inside, what's our recommendation for mask wearing and gatherings? Well, as it has been all along, wear a mask. If you're at home with your family and your kids, you've been around them all the time. It's different than going over to the in-laws' house where you maybe saw them 4 months ago and you're having a big turkey dinner. You gotta be careful. We are seeing a lot of new cases of COVID-19 in our region, and people are dying from it, including, as we noted, 2 under the age of 40 in the month of October alone. So we just want people to be careful. And it's generally, I'm not so much worried about the person who's wearing a mask and walking in like a Target or a Wegmans. They're probably okay. It's the person who goes over to the neighbor's house for a late night shindig with 10 other people, and there's a good chance if they're around these people for quite some time and they're not wearing masks, they can be transferred. So just be careful out there. Sandra.
On Sunday, there was a former Rochester radio talk show host who had boasted about the fact that she'd gotten in with a fake vaccination ID card. It sounds now like the state is looking into whether or not there was any fraud committed. Didn't know if this person had encountered the health department personnel, if they looked at her vaccination status. Also, there have been questions that have been lingering about whether or not the spouses of Bills players are also required to be vaccinated to attend the game.
The spouses of Bills players are required to be vaccinated. They're fans. They're no different than anyone else. They are required to be vaccinated. The CDC guidance with regards to facilities, including entertainment and sports venues, that require vaccination to attend, states that you cannot reveal an individual's vaccination status unless that person is consented in writing. It says it specifically. So I do not want to talk about anything that would put the county health department or the county at risk for a lawsuit. However, I can confirm without talking about vaccination status that that individual was reviewed by the Erie County Department of Health and Bill's personnel while at the game. And I will not go any further than that because I do not want to put the county at risk for a lawsuit with regards to improper release of an individual's personal health information under HIPAA. So you can make with it as you see fit.
There's no further investigation on the county end in regard to this?
We are working with New York State. They've contacted us and we will be working with New York State. But the county did perform an investigation. And beyond that, I can't really say much more.
Any comments on the stadium release, the stadium's study?
Well, I talked about it yesterday to some of the media that interviewed me. Well, first off, let me note that I do commend Governor Hochul. She did say that this would be released, and it was. I can verify that it was released timely because we did not get the version that was presented to the county and to the bills until basically 48 hours before it was released to the public. So it's not like we've had it for weeks. It was actually released and provided to our teams over the weekend. And I would just note that it's a roadmap. It's a guidebook for going forward. I don't want to get into the meat and potatoes of the negotiation because I never do. And I don't think it benefits the community if we start trying to negotiate in public. But it does provide a roadmap on the decisions that we are going to make, including having really some good analysis with regards to fixed cost for a new stadium in Orchard Park, a new stadium in Buffalo, of course the renovation. I will note that renovation is very expensive, and it probably does not make sense to do renovations when you are talking about a new stadium that could last more than double the life of a renovation, but the cost, while expensive in both regards, is not that much more astronomically more than a renovation.
What are your thoughts on, I mean, just obviously you don't want to talk about negotiations. Do you like what you're seeing? Do you not? What do you think?
I've learned in this business it makes sense to not go into all the particulars. I just think it's a very exhaustive report. It reviewed a lot of different things, not just the costs associated with the stadium, but the economic factors associated with the bills. I think a lot of people were shocked at the number. I think it was $27 million is the value of revenue that's generated for New York State and the county, the vast majority of it being personal income tax. I will note, having had conversations with AECOM, that is the direct amount, like sales tax generated from ticket sales. It does not include sales tax generated because people are going and buying pizzas and things like that. But we've always known that the vast majority of revenue that's generated from the Buffalo Bills goes to New York State through personal income taxes. The county gets sales tax on ticket sales and not a whole lot more than that, or sales at the Bills store. But it didn't take into account all the ancillary revenue that's generated as a result of games. So I think people were a little surprised by that. I do know that I figured was a fairly accurate number. And then it looked at costs associated with infrastructure, which we think was important to do. And now that it's out in the public has an opportunity to digest it, and just like we are, and will then have an opportunity to also provide their comment in the public sphere. Mark?
The state study said that it would cost $862 million to renovate the new stadium. How does that compare to the county study that was done in 2019?
The counties did not do a study to renovate the stadium. There was a stadium analysis report, which is always done every few years, to provide a description of potential issues that need to be resolved. It did not go into the specifics associated with the potential cost for those would be.
So it doesn't have like an overall figure for what renovating the stadium would be?
No, because it's an engineering report. It can provide some baselines, like on immediate needs For example, if a toilet, like they need to replace a bathroom, and they can estimate, okay, here's what that bathroom cost will be. But they did not do big picture costs as to what it would cost to renovate the upper decks or replace the upper decks.
Is that study going to be released?
We've released the executive summary of it. There's information in there that we do not want to release for Homeland Security purposes with regards to, truthfully, we don't want to release the study in case there's portions of it that could be used by a terrorist to blow the damn thing up. And if anybody knew, when you have strategic information about the actual building, that you put at risk. And so we're putting out the executive summary, putting out the pertinent information. We're not going to release every line item about it because it potentially could put the stadium at risk and the attendees there. I remind everybody, when we got heavily criticized after the 2013 lease was formalized and they saw all these giant rocks. I think you've heard me say this before. All these giant rocks that were put around the stadium gates. People are like, why the heck did you waste money on rocks for landscaping? I mean, these things are big. It's like they're not there for landscaping. They're to stop a truck bomb from driving up and taking out 3,000 people standing at a gate before a game. These are the serious issues that we deal with. And it's very concerning. We're very concerned about drones and drones delivering nasty items, such as dropping anthrax during a game over the stadium. These are the things that we deal with. And these are the things the NFL deals with. And we're worried about a drone that might have C4 plastique built into it that could fly right into a buttress and blow up with someone controlling it from outside the area. I know most people don't think about that when they go to a football game. That's why I joke when I go to Bills games anymore. I don't enjoy it because we're actually worried about the worst case scenarios. We have Homeland Security personnel there in multiple locations, and that's to ensure not only the safety of the people there, protecting individuals from a potential fight, but issues associated with something that could be much worse. And so there's reasons why we don't feel it's appropriate to release the whole report, because it could release technical data associated with the stadium, just like we wouldn't release a whole report regarding the Rath building or other governmental buildings that theoretically could be put at risk if a terrorist wanted to take a truck bomb or do something very nefarious to this building.
What would
Is it? Go ahead.
how do you think the report that was released yesterday will add context and continue to move negotiations forward?
Well, as I said earlier, the report is a roadmap. It's a guide. It gives us really definitive information regarding costs, including what would potentially be escalating costs in future years. $1.4 billion would be the cost for a new stadium, whether it's in Orchard Park or Buffalo. The costs in Buffalo are more expensive with regards to infrastructure. We always knew that was going to be the case. How much more? It gave a number of about $350 million, but it also said that's a low ball. It could be higher. It's a guidebook. It's a roadmap. It doesn't mean that it is the definitive answer with regards to location. I think it's just important that we have that information so we can negotiate on fair terms, that every side knows it. The Bills know it, the state knows it, county knows it, and of course now the public knows it. Yes, sir, in the back.
At times, the city has weighed in on their thoughts as far as stadium negotiations. What can the city do as far as either having their voice heard or getting a seat at the table as far as negotiations?
Well, I mean, a seat at the table, if the city's willing to contribute a substantial amount of money towards construction, then we might give them a seat at the table. If they're just saying, hey, we want to be part of this, but we're not going to contribute any money, it's tough to say you deserve a seat at the table if you're not willing to contribute and help build the stadium. Simple as that.
Going back to the vaccine for kids, they're already required to get a lot of them to go to school. So are there ever any talks with superintendents or the state to eventually require this COVID vaccine?
That it's premature to have that discussion because I believe this is an emergency use authorization, not a permanent authorization. Yes, the doctor's saying yes. So generally, you would not see a vaccine mandate until you had permanent authorization. That's out of my bailiwick. That will be a decision that will be rendered by the New York State Department of Health in consultation with the New York State Education Department. So right now, I wouldn't even think it's on the table because it's emergency use authorization only, and you would never mandate for children vaccination to attend school until it had gotten permanent authorization. Brendan?
India Walton 20 minutes ago said seems unlikely we'll end up with enough votes. While it's unofficial, it looks like Mayor Brown's going to have a fifth term. What are your thoughts on that?
I talked to both of them last night. I talked to India in person, as well as Mayor Brown on the phone. It was a very, very vigorous battle. My position as county executive, I was intimately involved with my team and political team working on the county races. And a lot of people were wondering, why weren't you involved more in the India Walton or Byron Brown campaign? And I didn't endorse either, because I was focused on electing a new controller, hopefully electing a new sheriff, keeping the legislature, helping elect a new supervisor in the town of Hamburg, which happened with Randy Hoke, and ensuring that Brian Culpa would get reelected in the town of Amherst. I certainly wish both of them very well. I had great cordial conversations with both Ms. Walton and Mr. Brown during the campaign. I did let Mr. Brown know it appeared looked like he won last night, and if that's the case, we'll continue to work together to create the best Buffalo we have. And as I told Ms. Walton last night, she ran a very strong, vigorous campaign, and I wish her the best going forward. And truly, she's an important voice, I believe, in this community. Even if she's not mayor, she has a voice, and I'm sure we'll hear that voice a lot more.
I just want to clarify that comment. I think after India Walton won the Democratic primary, you were asked about whether or not you supported her candidacy, and I thought at the time you had said that she is the Democratic nominee and you support her. I just want to make sure that I want to know if that's the case or not, that you did or did not support her.
I never endorsed her. She never asked for an endorsement. There's a difference between endorse and supporting our Democratic candidate. I did not actively campaign on behalf of Ms. Walton. Simple as that. Wasn't asked to either. At this point, we were focused, and I have to admit, it was a very, very bruising year in many different categories, but we focused our efforts, my political team, on the county races. From a purely standpoint as county executive, we wanted to ensure that we kept the legislature in Democratic hands so that we could continue to work together on a lot of the things that we've done the last few years. Passage of a number of laws, ensuring that we're getting good budgets through. And that happened. Looks like it will stay 7-4. We elected a great individual in Kevin Hardwick to be the next county controller. While Kevin and I in the past have never agreed on everything, there are times in which we disagree on some things, we've always done it in a cordial manner. It hasn't been flame throwing and bomb throwing as unfortunately we've seen otherwise. So while I would expect that Kevin will retain his independence and will criticize me and my team occasionally, I also believe it will be based on factual information, not just because it's politics. The sheriff's race, we worked very hard in the sheriff's race. It hasn't been decided yet, but it does look like John Garcia will be the next sheriff. And I just look forward to working with him, as I have in the past, with regards to ensuring that we're doing the best to protect the people of Erie County. Very proud of Randy Hoke and the race he ran. He ran a really clean race, a race on the issues in the town of Hamburg. He ran against, as we know, a controller who was very incendiary, and Randy had a big victory. And as I told him last night, I'm proud of you, but more importantly, I think if your father was still here, he'd be proud of you of the race you ran, and that you are going to be the next supervisor. Brian Culpa, the team in Amherst. Sean Lavin, of course, is our Director of Veterans Affairs, who's currently serving the National Guard. Won re-election. Brian Culpa won re-election. Jackie Berger is a little behind, but I think she'll win with regards to the absentee ballots. And it's a big county, 950,000 residents with some very important races. I know for a lot of people in this community, the mayor's race was the only thing they were thinking about, but there were some very important races going on otherwise. And that's what we were focused with our resources. And I will note that we did very well last night. It was not the case for Democrats across New York State. Some of them got pulverized, including on Long Island. Long Island was a very bad night for it to be a Democrat running for a countywide position or a council or legislative seat. It appears my colleague from Nassau County, Laura Curran, lost her race. The district attorney candidate, State Senator Todd Kaminsky, lost his race. The sitting county controller in Nassau lost his race. The sitting district attorney in Suffolk County lost his race. All Democrats. So we did pretty good here compared to what we all know happened in the rest of the county where Democrats didn't fare too well. I think it's because we focused on the message of what we stand for as Democrats in Erie County, and how we actually have done good government. We've balanced budgets. We've provided for the public, and of course, we've been there during the COVID-19 outbreak, and tried to avoid the flame throwing and nastiness that often exists in today's environment. And it showed with big victories in tough races, especially in an environment where it was very difficult for Democrats to win statewide. When I say statewide, I mean in counties and towns and villages and other parts of New York State, and nationally. I haven't confirmed it yet, but it's possible from what I've seen on the statistics and the results from last night across the country. Kevin Hardwick might have been the only Democrat to win an open competitive seat for a countywide office. Everyone that I've seen so far from across the country, and I keep track of this stuff, appears to have lost. So if that's the case, pretty damn big victory for Kevin Hardwick and our leadership and team that helped him along the way. Yes.
Hopping back to the bills really quick. Over the weekend, 258 people were refused entry because of health sanitarians. Just wondering if you could comment on the increase compared to the first bills game where they had 3 tests.
I'll turn it over to Dr. Burstein. She's got more information, but we actually put more sanitarians in place, and they actually stopped more people with checks, including problems with individuals who showed up who may not have had ID on them or the card that proves that they were vaccinated, so we could look them up in the system. But I'll let Dr. Burstein talk a little more about it. But there was more sanitarians on duty, which is one of the reasons why we were able to interview and talk to more people.
Thank you. Well, I think there are a combination of reasons why we were able to screen out and identify more people who were not fully vaccinated. First of all, the rules of engagement were different, right? So the previous games, people had to have at least 1 vaccine dose. This is the first game, this first home game, where it's people required to be fully vaccinated. So it's, for the mRNA vaccines, it's 2 doses plus 2 weeks time. So with the J&J, again, it's 1 dose plus 2 weeks time. So it's a little bit more tricky, but the requirements are a little bit higher. And also, we, as the county executive mentioned, we had more staff than we've had in previous games. And we also worked really well. The Bills were doing a great job of screening, being very diligent. And we were referred, I think, 1,128 individuals to investigate their true vaccine status. So the Bills were working very hard to ensure that anybody with a questionable vaccine status, either they didn't have any identification or any vaccine card, or it looked their information looked a little tricky, referred them over to the health department. And so I think it was a combination. And then also I've heard that the Bills, even through their own screening, were able to identify individuals that didn't qualify entry and turn them away without even referring to us. So there's probably even a larger number that were turned away. So the bottom line is we all take this very seriously, to be safe and healthy during a Bills game. And we've seen that. We haven't really seen any huge outbreaks as a result of the home Bills games. We actually saw more cases associated with away games in the South, where there are higher COVID case numbers. So I think we're working really well with the Bills and the sheriff, and I also want to sincerely thank them, the Bills and our Erie County Sheriff's Office, for working so well with us to make this process work successfully. Thanks.
I just want to clear something up. I saw your face when I said about Hardwick and open competitive. That means it was a non-incumbent. Like George Latimer, the county executive in Westchester County, was running for re-election. He did win. But in an open seat where an incumbent was not running, and it was a competitive seat where it just wasn't one candidate on the ballot, everything I've seen so far indicates that Kevin Hardwick was the only Democrat to win. Now, I haven't seen all the data totally, but I reviewed probably probably about 60, 70 races since last night, and that's a pretty important accomplishment. Mark, you had another question?
On the stadium again. What happens if, assuming that a stadium is built, a new stadium is built, what would be done with Highmark Stadium? And why wasn't that, would it be demolished? Would it be reused somehow? Why wasn't that included in the state study?
My understanding is it was included in the 1.4 billion, the assumption that you got to remove part of Highmark. That's what we were told. The idea is you will have to take down the old stadium.
Do you have any idea what that might cost?
I don't know off the top of my head.
So it's not going to be part of any kind of future stadium or park?
The current stadium would not be part of a future stadium. It's possible you could retain the lower bowl and some other things and make it a much smaller.
Not part of the stadium, obviously, but part of some sort of development with the new stadium or something?
Well, let's put it this way, we still haven't decided where the stadium's going to go, whether it's Orchard Park or Buffalo. So, the only thing that would be basically still there after all is said and done would be the field house and the other ancillary buildings that exist, like the training facility and stuff like that. Those would stay, of course. The goal eventually would be, once the new stadium is built, to take the old stadium down, because you'd have to. You just can't have it sit there and just eventually degrade to the point where someday someone's walking by and the thing collapses. And there'd be no reason to spend excess amount of money to stabilize a facility you're not using anymore. If there are no other questions, I want to thank everyone for coming today. We do know that COVID-19 is growing in our community, unfortunately. Individuals that are fully vaccinated could catch it. There's never been an issue or a question associated with that, but you will be protected from serious illness. While there are individuals who've died in our community who are fully vaccinated, the vast majority of them are over the age of 70, and still, even then, the majority of them are over the age of 80. So it just goes to show that vaccination protects you from serious illness and death, especially if you're younger. And now that we have vaccination available for every child over the age of 5, we are really asking parents, please get your kids vaccinated. If you want to get back to normal, no masks, things like that, not having room sizes changed and so forth, which still exists in some of the classrooms, the best way to do that is get all children fully vaccinated. Take care, everyone. Be safe and well.